And hello, everyone, and welcome to our presentation today on expanding healthcare access for all, the Latinx patient and the importance of medical Spanish. This year, our International Education Week here at Marymount is focused on the theme of building a sustainable global future, with each day focused on a different United Nations Sustainable Development Goal. Today, we are focusing on the theme of global health and well-being, a goal which focuses on the health of the world's most vulnerable populations. We are honored to be joined today by our colleagues Luis and Joe of EdOdyssey. This semester, Marymount has partnered with EdOdyssey to offer 6 Marymount students scholarships to earn a certificate in medical Spanish. Here at the Center for Global Education, we are considering ways to ensure that our language offerings at Marymount meet the needs of our students and prepare them for work and life in an increasingly global world. With our strong programs in nursing and health professions, the Medical Spanish Certificate will allow students to further distinguish themselves in competitive healthcare fields. So it's now my honor to introduce Luis Garcia, who will be leading us in today's discussion. Luis serves as a cultural advisor at EdOdyssey and has over 9 years of experience as a remote medical interpreter for LSA. So without further ado, I'll go ahead and turn it over to Luis.
Thank you, and thank you so very much for being here, actually. Huge thanks to Marymount for giving us this opportunity. As you heard, we at the Odyssey, in other circumstances, for example, we would create immersion programs for people who visit Peru, and combine that with the overall experience that I've gathered through the years, over the years as a medical interpreter. We noticed a couple of things, right? One of those, and it's part of the huge point that we want to make, is that language alone is just not enough. Culture is what we call, it's just the second part of it. It's just like two faces of the same coin, if you want to call it that way. And they have to be together if we want to have something that is whole, something that is complete. So that's what we'll talk about today. That's why we came up with this. We're doing this kind of effort. Okay. So yes, we're throughout this, this time, what we're going to talk a little bit about what we call sustainability in health, or what I understand it, and part of the reason why I based this program on, and also what experience do Hispanic patients experience, or what do they have in the American healthcare system? Because our belief is that each of us as a person, we carry what I call a cultural backpack. Okay, it's everything about what we learned over the years, what we grew up, and that is something that we will carry with us with the rest of our lives. So when we move elsewhere, when we move to another country, there's this clash, right? This impact that we have, and we understand things through the eyes of that backpack. Okay, and so the role of culture and language, how does that apply to language? How does that affect it? And what we do at EdOdyssey about it, okay? So I wanted to start with a couple things that I want you to have sort of in your mind, lingering in there for the rest of the session, okay? And we start with this: the overall experience of, or what is this, the status or the state of Hispanic or Latinos in the United States when it comes to health, okay? And what we see now, it's what we call the panorama. It's not positive, okay? We're not doing well. We're not okay, and we don't have access to healthcare, and that can mean many things. Actually, you either don't go to the doctor, or you don't do follow-up. There's a number of reasons why that happens. Okay, and this is from an article from the Atlantic. Okay, and they were talking about why do Hispanic patients dread just don't want to go to the doctor. Okay, there's reasons for that, and I will touch on that. Okay, so we need to ask ourselves, right, what's going on, what's happening, how can we solve it, how can we work on that? Okay, that's one thing. The other thing is another thing that I kind of liked from working on the interpreting field. It's about linguistic relativity, okay? And that sort of talks about that your particular language actually defines or influences the way you think and you understand the world. But actually, I would counter that with saying, I think it's the other way around, okay? The way you see the world and the way you understand it, it's expressed in language. If you want to do reverse engineering of culture, if you will, you start with language because that's what it shows. Okay, that's what you end up, expressing. You just say that. And just to have an example, to give an example, in Spanish, as opposed to English, you have the verb to be, and we have two things. We have ser and we have estar. Okay, commonly it's explained that ser is just it means that it's a quality of you that you carry permanently. Okay, and estar is just to explain that something it's a state. Okay, it's not permanent. Okay, but if you want to go a little bit further, if you want to get philosophical with things, in English, you cannot separate your existence from where you are in physical space. Okay, in Spanish, we can separate, we exist, but we exist independently of where we are in space. Okay, because we know that that second part of it, it can change. Okay, and when you go into that rabbit hole, it's going to be a point in time you're going to go, it's just the realization, and that comes and that happens when you understand language, when you start thinking in that other language. Okay, and you can have things like this example right here. Okay, you can say soy enfermo and you can say estoy enfermo. Okay, English does that, I think, with tone. You can say, you're sick. Look at my face, hear my voice, you're sick. But then I can say, you're sick. I'm gonna prescribe you something. That's different, okay? Yeah, in Spanish, we have two actual words. So we don't rely on tone in that particular example, for example. We just have different specific words for it. Okay, and that may be just a simple thing, a tiny thing, but it will, expand to more complex things, for more complex scenarios. In this particular case, the healthcare scenario, right? So keep those two things in mind, because these two things apply to what we call sustainability. Okay, sustainability, what is it? It's something that if you're driving, you hear on the radio, talk radio, whatever news outlet you use, for example. Okay, something that sounds official, it's policy related, yeah, but what is it? I mean, if I want to think about it as a student, what is it? What do I mean? Okay, and it's something that, yeah, you go to basics, something that can be sustained. More, if you want to go more into that, it's good health that can be maintained over time. Okay, it also talks about access. What is, or when is health sustainable? For example, it's when you cut your finger and you get a band-aid, and you can actually get that band-aid. Okay, it's when you're overweight, for example, or you're underweight, but you can access and you can have dietary advice or information. Okay, it's when you understand when you're being told. We're talking about medical instructions, prescriptions. You understand what you're doing. You understand what the doctor is telling you and why is the doctor telling you that. Okay, and it's when you need surgery, for example, and you can actually get surgery, and you can get surgery timely. That it's a whole set of situations that mean that you can access health, and you can access it when you need it, and you can access it when you need it over time, not just once, but uh, whichever amount of times you need it. Okay, what we're going to focus on today is on the understanding side of things. When you understand what you're being told, okay, you can have an interpreter on the phone at the very location, but that does not mean that you're going to get a full understanding of what either your patient thinks, and the other way around, that your patient is going to understand what you actually mean by what you're saying. Okay, and I'm going to give you an example, okay, because this actually happened. It happened on the field. Okay, keep in your mind the concept of nurse practitioner is something that you know, especially in the US. You understand it. You've done it 1,000 times, or whenever you needed a checkup. Okay, so get this: you have a patient, and just imagine, but we're all healthcare professionals. Okay, so we have a patient. They walk in for an appointment. They have set up over the phone, or whichever way they used. Okay, but then they are triaged. Okay, they are assessed. Their condition is assessed. Okay, what do you need? Okay, come here. Okay, but then the provider walks in. It's a female provider, for example, and she introduces herself. She says, "Hey, hello, I'm a nurse practitioner." The interpreter relays that, "Hey, hello, I'm a nurse practitioner." Okay, but then something happens. Okay, the expression on your patient's face changes. Okay, then you notice that they're upset, and the situation continues to escalate. It escalates. Eventually, the patient refuses to be seen. She starts yelling, and through the interpreter, you know that the patient is yelling, "I want to see the doctor." Okay, and then the patient walks out. I mean, what happened? Okay, that's what we're going to answer. Okay, what just happened, right? What happened is that the patient did not understand what a nurse practitioner is. Okay, I didn't understand what a nurse practitioner was until a few years ago. Okay, and that's already speaking English and sort of having a grasp of, the American system, the United States system and culture. Okay, I didn't understand what it was. The patient doesn't understand what it is. Okay, the provider assumed that being in the US, the patient had an idea of what a nurse practitioner is. But why am I telling you this? Because in most Hispanic countries, Peru, where I'm based, is an example, for example, we do not have the category, the position of a nurse practitioner. Okay, as far as I understand it, it was a response to a lack of healthcare professionals, doctors in the US. So when there was primary care needed, and many patients needed primary care, yes, a nurse practitioner is a healthcare professional that is qualified and authorized to treat patients at a primary care level. But here, for example, in Peru, in most Hispanic countries, we do not have that category. So a nurse is a nurse and a doctor is a doctor. And a doctor can do things that a nurse cannot. And that's the way I understand it. And in Peru, for example, in our culture, image is huge. Image is very important, okay? Qualifications are very important. Who are you? What have you done? Okay, a nurse is a nurse and a doctor is a doctor. If you're a nurse, you cannot see me because I want to see the doctor, because the doctor has to prescribe and can prescribe things. Okay, so because that's why I understand, that's what I memorize. You remember what you understand. Okay, if I hear nurse practitioner, if I hear enfermera profesional, that's what we refer to generally, okay, I just stick to enfermera. I just have nurse, and that word just sticks to my mind because that's what I understand. I don't understand the rest, so I'm going to keep that. I'm going to hold to it, okay? And that's important to know, okay? And that's culture, and that's the two things mixed together in that particular context, okay? We need to know that in order to understand what's going on, and also to solve that situation, to get that patient, no, please come back. This is what it is. This is what's going on, okay? All right, so I'm going to throw at you some numbers, okay? Because this whole situation that you seen, it reflects on the numbers, okay? There's a vast percentage, a huge percentage, I would say, that they Hispanic Latinos patients in the U.S. that they don't visit a doctor, okay? They may receive a prescription, but they don't go in and retrieve that prescription or the medication. A huge percentage as well, they don't even go to the doctor, but they use alternative medicine. Okay, there's a reason for everything. Okay, we don't just do things. If you ever took a psychology class, there's a motivation for every conduct that we have. Okay, if you can see the statistics and you're puzzled at why is it that the Hispanic population in the U.S. is not being seen. My particular take on the situation is that they're not having a good experience. It's subpar. It's like when you have a class that you don't enjoy, you just want to be done with it, or either that or you don't go to it. Okay, when you had a bad experience, you want to avoid it. Okay, as much as you can. Okay, if I had a bad experience at a doctor's office, like our last example, I won't go back. Okay, and that is part of sustainability and health. If your patient doesn't go back to you, then there's no follow-up just because of a little misunderstanding. Look how it snowballed, right? Just because they didn't know that tiny particular fact about Hispanic culture in healthcare, right? So yeah, they developed rejection, aversion. I don't want to do it. I hate it. I don't want to be there. Okay, so that's part of the reason. Okay, and that permeates. That's we can observe it in testimonies. Okay, information is being talked about. I don't get enough information. Okay, I need more time with the doctor. That's a whole other discussion whether there's enough doctors, and we discussed it in the course, by the way. But also, the patient says they didn't give us a lot of information. But what happened there? Sometimes the doctor did relay a lot of information, but what you remember, that's a whole other story. Okay. Remember, what you understand, it's what you remember. Okay. If you understand it, it sticks to you. Okay. And not necessarily if I'm talking proper Spanish, for example, it means that you're going to understand it because your Spanish may be culturally modified. It may be easier Spanish, maybe harder Spanish. The point is that if you don't understand it, it doesn't stick to you. Okay. And then when someone asks you about your experience, yeah, you're going to say, no, I wasn't given a lot of information. Maybe you did, or maybe you were given a lot of information, but you just didn't understand it and you didn't remember it. Okay. And that reflects on your experience. Okay. Also, attitude. Okay. A friendly nurse. Okay. Someone that welcomes you. We appreciate that. Hispanic culture appreciates relationships. Okay. So please be nice to me. Right. And other things like already told you this, it is what it is. No, it is not the way it is. I need to understand why things are the way they are so I can appreciate it or just, follow through. We appreciate that. Okay. So yeah, there's a problem. Yeah. What happens? Yeah. Patients, they don't go to the doctor. Okay. They don't use the medication, just like we showed in the numbers. Okay. They they feel that they're not getting enough information, and they feel that they don't have meaningful relationships with their providers. Okay. The end result, yeah, they don't understand me. Maybe they do, but it's just that they perceive they don't understand it. Okay. What's a meaningful relationship? That's a whole other discussion that, again, by the way, we talk about in our program, for example. Okay. What do we appreciate? What we look for? Okay. Different cultures appreciate things on a different level, in a different way, okay, and value different things, and we need to understand that. Okay. And yeah, I want to give you guys another example just to prove my point. Okay, it's just like using Google Translate. If Google Translate worked at 100%, I'll be out of a job. Okay, why? Because I can give you context and I can give you cultural information that will understand why a translation in particular may be accurate, but not necessarily be appropriate. Okay, and check out the second example. Okay, al que madruga, Dios le ayuda. If I input that into a translator, uh, yeah, God helps the one who wakes up early. Yeah, I understand it, but I don't feel it. Okay, it's a feeling. I don't feel it. But if I tell you early bird gets the worm, yeah, I know it because I've heard it, especially if I lived in the US for a number of years. But you can go deeper, actually. You can get, philosophical with things and language, and tell you how people think. Okay, what does this tell you? There's the mention of God, and yeah, you know that God helps the one who wakes up early. What does it mean? It means that Hispanic cultures believe in not only believe in a higher power, but in Hispanic cultures, a higher power helps me achieve my goals. In English, what I can learn from what I see in the language is that you do your own work. Okay, early bird gets the worm. You do your own thing. You get things your way. Okay, in Spanish, we get help, or we need help, or we do our things with the help of a higher entity or power, if you want to call it that way. And I just got all that from two phrases. okay? And it's important to know culturally what phrase is appropriate, not accurate, but appropriate, because it has to do, again, with the way you think, okay? And I can also give you this. I took this from a movie, but it's, if my only tool was a hammer, everything would be a nail. What do I mean by that? If you just learn Spanish, but not the cultural things that surround it, then it's just a layer, because underneath it, you're still going to use Spanish, but speaking on the cadence coming from English, or using phrases coming from English, just in Spanish, just like putting on a mask. Okay, but it's still you underneath. Okay, but culture is different. And a point that we talk about in the program is this: you have a large percentage, for example, of undocumented immigrants that live in the US and that require assistance. But what happens? They're constantly worried about their whereabouts being discovered by authorities. That needs to be talked about. And that reflects on language, how on the choose or the selection of words that you use. For example, the concept of insurance as medical insurance versus social security, okay? If you want to speak proper Spanish, insurance is seguro, seguro médico, if you want to call it that way. But what happens? If you are an immigrant in the US, the term seguro, it's short for seguro social, and that's social security. Número de seguro social, social security number. Okay. If I hear seguro, tienes seguro, I'm asking, or they think I'm asking if I have a social security number, which means that I'm inquiring about their legal status, whether their status in the country is lawful or not. Their reaction is going to be, oh, okay, no, I'm scared because you might report me. And then I just block myself and I stop answering questions because I'm worried. Okay. If I don't know that fact of culture, for example, then I hit a roadblock with my patient. Okay. And that experience is just fed back to the system. I call it a system. And it modifies language and it adapts. That's why there's an urban dictionary, for example. Okay, it wouldn't exist if society or if social groups didn't manipulate and transform language in the way they understand it at a particular point in time. Okay, that's why it exists. And what's cool about Urban Dictionary is that we get the context and explanations. Okay, they're not proper, but they're appropriate because of what's going on right then and there. Okay, and yeah, I can give you another example. All right, in my opinion, what I perceive is that English is very literal as a language. It goes to the point. Take two of these and call me in the morning. I don't give you more information. Just do this, and if something happens, just get back to me. Okay, Spanish doesn't work that way. I need to get closer to you. I need to dance in a circle and slowly get closer to you while I tell you what I'm doing, just to build that relationship. Okay, in a second example, you see again an example of that. Okay, ma'am, you see, look, I'm giving you this for this kind of problem, so let's go ahead and try and see it, right? Otherwise, we just change it, but let's go ahead and start with this. Okay, I'm dancing in circles. You can see that in Hispanic music, Hispanic culture, Hispanic dancing. We flirt, we go around. Okay, it's not direct. Okay, and that happens. Okay, so with everything that I told you, what do we do? I mean, well, and it's part of the reason why this program exists. Okay, at EdOdyssey, with that knowledge, okay, because we believe there's two sides of culture coin, for example, when language and when culture backpack. We teach the language, but we also let you know about what happens around it in a particular time. Okay, yeah, we do teach you vocabulary, grammar, and the rules, and this is this, but we also tell you, depending on what circumstance, what words fit the best given that particular moment. And these things are important. Otherwise, ask a lawyer why the contract has a particular word instead of another, because it has meaning. Okay, otherwise we wouldn't have so many words for a single thing. Okay, there's a circumstance for something. Okay, we teach syntax, we teach, yeah, this is like this and this and this and this, but also context is important. What's going on at that particular moment, and I'm going to say it over and over, it just drives and affects your choice of words, especially if you want to build a good relationship, because this is what Hispanics as a culture, this is what we want. We want meaningful relationships, okay? So that's what we want to achieve. How do we do it? It's an 8-week program, okay, that we have. We have 2 modules. We have a language module, we have a culture module, okay? And it's taught from my point of view, okay, my country's point of view, Peru, okay, what is our experience in healthcare? Because I think we're in a position that we are diverse enough that our experiences in healthcare management can be extrapolated to the rest of the region, okay? We do it in 4 sessions per week, and again, 2 language sessions, 2 culture sessions to put everything into context, an hour and a half, so it's a total of 6 hours a week. Okay, I teach the culture module, and our partner El Sol, which is Spanish language school, is in charge of the language module. So yeah, that's what we have. Again, language alone is just not enough. I mean, it's just one side. You need to know that, and you need to know that cultural part of it. Okay, and we use that experience to connect with our patients, to solve what's going on. If you ever were puzzled about why my patient is not coming back, yeah, there's a reason for that. And we want to let you know what the reason is. And we want to discuss things. We want to talk about things and get your input also from what your perspective is. If what we mentioned was new to you, or you think the opposite way, and why. Okay. And yeah, what researchers think that was unknown, it actually, you know, comes to light. Okay. So yeah, that's what we do. And again, thank you so very much for your time. I'd like to go ahead and take your questions about what we do about our philosophy here. And I'm not sure if Judy and Erica, which are 2 of our students, have joined the meeting right about now. But if you are here, the rest of the participants then can go ahead and ask any questions if you have about the program. Thank you.
Thank you for opening this up. Again, because this is being recorded, if you would rather submit your questions anonymously, you can submit them to me, Anna Sophia Alcraz, and I will read them out loud. But yes, we open the floor to questions.
Luis, thank you so much for your presentation. This is Victor Batencourt. I enjoyed your presentation and your perspective on this. I guess more than a question, since this is the first time we do this, and probably for you is the first time as well doing this virtually, you have some of our students, they're not here, so I want to talk about them right now because they're not here. Can you tell us, I mean, in the process of teaching them and the language and everything else, what has been the challenge or questions that they may have had as you're teaching them? You know, something that what am I trying to say? I'm trying to think about, you know, how was the experience of teaching them, and what sort of questions they may have come up as they were learning, or what was one thing that surprised them that you taught them that they were like, oh wow, that's great?
Well, I think one of those parts was I remember this one example that I gave, in which how a single word can change the meaning of everything and can help integrate things. And it was a particular example of explaining the concept of a nurse practitioner to a patient. And it was the use of word we, like in nosotros, and they expressed like in le, and I'm going to expand on that. we mentioned the fact that there's a big elephant in the room, that is that our cultures are different. Okay, and when you're a Hispanic patient in the U.S., you know that you're someone from a different background and culture in a different country. So how does that work? If I am a Hispanic worker in a healthcare facility, and I want to explain to my patient that there's such a thing as the nurse practitioner, I would tell my patient, hey, this is what they have here. And in this place, they have this concept of a nurse practitioner, and they are qualified to treat patients and whatnot. But the importance is the use of the word they. Okay, what that means is that, hey, we it's not that we're related, but we share a culture. You come from that country. My family is Hispanic. Okay, our background may be Spanish. So this is what the United States, the American healthcare system have. Okay, I am presenting someone to another system, and that was, I remember that moment. That was surprising. And I can give you another example to expand on that, and it's when you were in college, for example. I had an exchange experience. We were at this party, for example, and we were a group of 6 Hispanics, okay, and at a house, and we spent a good half hour just sitting there, okay, because we didn't know that we had to introduce ourselves. In the U.S., you introduce yourself, okay. In Hispanic cultures, we are introduced, okay. Now, Hispanic cultures see being introduced as something of respect. If I introduce myself, I'm being cocky about myself. Okay, I think that I'm way too superior, and people need to hear about me. That's what we think about it. Okay, it's just different. It's not better, it's not worse, it's just different. Okay, and that applies. And the whole thing I just mentioned, it's included in one word: they or we. Okay, and I would say that was a nice moment when they understood that, and when they realized that.
Gracias.
Hi, Luis. This is Jen. Thank you so much for your presentation. It was very insightful. I did notice that we have one of our student participants on the call, Judy Ortega. So I thought I might go ahead and direct a question to Judy, if you can hear us, Judy. But as a student participant in the program, what has been your experience and your biggest takeaway about language and culture?
Hi, Jen. Thank you, everyone. So I have been studying the Spanish language for 8 years, and I know that I want to work in the medical field, and I never really found a program that integrates both like the medical field and the Spanish language. But so far, like, I have absolutely found this program to be extremely beneficial to my future career. And I love the Spanish language even more now, because I have been integrating both of my 2 passions for the past 7 weeks. And so I can definitely see myself using this going forward and within, my work. So, yeah.
Okay, do we have any other questions?
I have one question for Judy. This is Victor again. Judy, was there again sort of anything that you learned? Obviously, you learned throughout the process, but was there anything in specific that struck you? It was like, oh wow, this is very interesting. I never thought about this. Never heard of it. I don't know. I'm just sort of wondering what was that aha moment, if you had an aha moment during the period of learning.
Thank you, Victor, for the question. During the cultural aspects of the program, specifically when like Wednesdays and Thursdays with Luis's class, I have had many eye-opening moments into like the Hispanic culture, and now realize that, you know, I don't have to just know the vocabulary in order to take care of a patient, but also their lifestyles and like their practices, and take that into consideration when taking care of a Hispanic patient. Specifically, like learning about their diet, you know, that's important to know. Their access to the healthcare system can be very different on like in different scales. And so that's also important to take into consideration. I know more recently we have been focusing on like undocumented patients and how to work with them. And that I know there's like kind of, I don't know, stereotype is the right word, but whenever we go into the medical field, you know, we're very knowledgeable in what we do, and like we use all this extensive vocabulary, but Luis always emphasizes that we have to kind of break down the vocabulary and not always use such extensive vocab in order for our patients to understand. And so that's eye-opening, because it's like we're kind of taken back, and you know, we have to consider like the knowledge that our patients have, and more so of their backgrounds, and not just them within the clinic, but also outside the clinic.
Well, thank you. That's amazing. I'm so glad to hear that you make that connection, and you know, and we know that healthcare workers are compassionate, but this adds another level of compassion and understanding, getting to know their culture and where they're coming from, you know, and often, and what to me is even more amazing is that sometimes we have to take ourselves for our environment and go somewhere else to learn these things. So, you know, you would have learned that in Peru and Costa Rica to be closer to the culture, but now we're taking advantage of this, the new normal, and you made that connection. So to me, that's amazing. And I'm hoping that when others hear this recording, we'll get that, and that we can continue moving forward with this type of program at Marymount. We do an excellent work educating students that will go on to medical professions, health professions, but I think adding this piece will really take us to the next level, and it goes well with the mission of Marymount. So thank you, and thank you, Luis, for teaching that. That's great.
Yeah, it's been. I mean, I'm very happy for the opportunity. It's something that was. It was in our minds for a long time, especially the culture side of things. Okay, it's something that in the past you would have needed to go there, and even then we've seen some instances, or we know of some instances that traveling to a country doesn't necessarily mean that you have immersion, just because it depends on the point of view. Some people just see it as vacation, and yeah, I mean, you don't absorb much, because what's a vacation? You just want to escape, right, from things. You want to relax, and then you want to, you know, sort of unplug your brain. But if you just need to change the perspective. If you go with the perspective of, yeah, I want to understand things, then the input changes as well. So this is what we're trying to do with what we have, and it's sort of like a know before you go thing, okay? And it's awesome that yeah, you will be able to navigate the system when you're here, but knowing that there's so many Hispanic patients in population in the U.S., you have that right there, or you have it next door, for example, or you have it at the nearest medical center, and yeah, it's useful, and yeah, it's something that you keep with you. And Erica's here. Hi, in case anyone has any questions for her, or if she, wants to talk about something or anything that she liked or she appreciated about the courses she found interesting, if anyone wants to ask a question.
I have a question for Erica. This is Jen. Erica, I know that when you came to me, and told me that you were a native speaker of Spanish, and you wanted to kind of hone more of your Spanish skills for a more professional medical setting, with your goal of becoming a nurse. So I wanted to see what your experience has been, as a native speaker of Spanish. What has your experience been with the program, and what are your biggest takeaways from it?
Yes, thank you so much. That's a very good question. Well, I decided, that this course was going to teach me more Spanish skills, grammar, and help me understand the Spanish culture more, because I'm Salvadorian, but I know that the Hispanics have so many cultures and viewpoints in every country in Latin America. And even though, I'm Hispanic, I still get to learn, even more about, the Hispanic cultures, what's traditional medicine, what they do in other countries. Also, I wanted to learn more professional Spanish, but then considering the fact that many Latinos also have not gotten the chance to get an education, they might not be able to understand, very elaborate words. So Luis has taught me that, I have to understand where people are coming from, and, be more humble in language, so they are able to understand what I'm saying. And, if I meet someone that is Latino that has had an education, then, I can use my professional level of Spanish. But I've really learned a lot. And even though, I'm a fluent Spanish speaker, you never stop learning. And there's so many things that you could do to improve yourself. So I really love this program.
Thank you so much for sharing. That sounds really, really interesting. And that kind of ties into my question. And this is a question to Luis or Judy or Erica, whoever wants to answer it. We know that the Latinx community is really diverse, even within countries. We've got a lot of different cultures. In the course, do you sometimes look at specific cultures' approach to medicine, or is it looking at more of like education level? It definitely looks like education level is touched on, approaches to medicine, of course. And I was just curious if it also touches on different cultures or country perspectives or region perspectives sometimes.
Yes, if I may, I'd like to answer that, because actually gave a couple examples, and we gave a couple examples in class, because it's like I mentioned, it's sometimes part of a huge elephant in the room, because there's differences that sometimes may be taken as stereotypes, but they have a reason why those stereotypes exist. What we do is we don't look at it as a stereotype, but we look at why those happen. And a particular example that I think I've repeated more than a couple of times is the difference in between Hispanics from the Caribbean region. And I'm talking about Cuba, Puerto Rico, and the Dominican Republic, and Central America, and how they are compared to people in South America. and it's a question of attitude towards things. Other times it's vocabulary. What I mean by that is that, for example, someone from Puerto Rico, because of Puerto Rico is a territory of the US, there's a lot of exchange, either people traveling back and forth, either people moving from the US to Puerto Rico, or from Puerto Rico to the US. There's an exchange. If there's people moving, then language is moving. What happens is that they end up speaking not Spanish, not English, Spanglish, and that's different. Okay, if you have someone from Latin America or Central America that travel to the US, they end up at a clinic and they're being seen by someone that grew up in Puerto Rico. In that universe, in that exchange, then there's a chance that they may not understand each other that well because, again, the worker from Puerto Rico is using Spanglish as opposed to someone from, say, Peru. We just speak English. Oh, I'm sorry, we just speak Spanish rather, just because there's not that kind of exchange. Yeah, we do have tourists here, but they're, if I may, busy traveling. So there's not that much exchange at the level that happens in that region. Okay, that also reflects on attitude, because we know that people from the Caribbean region, for example, are more intense in their expressions. Okay, the way they talk, they're louder, and that again, it's not necessarily, doesn't necessarily mean that they're angry about things. It's just a way of feeling things. Okay, so they speak louder. We actually, yesterday, last night, we were talking about public assistance programs, and I was mentioning that because of this exchange of culture and information between, for example, Puerto Rico and the US, or Cuba and the US, because of being so close and people moving around, there's a higher chance that or they're more likely to be aware of their rights and of the programs that are available to them. And that, coupled with the approach or the attitude towards things, reflects on what is perceived that being entitled, but not that particular word, but as demanding. They demand assistance being given to them. If you have, for example, someone from Puerto Rico that needs food stamps assistance, for example, SNAP in the US, they will demand it. They will ask in a way that you have this, I need it, you need to give that to me. There's a difference. If you are from South America, for example, you view assistance as someone or something that is granted to you, okay? And you appreciate the fact that that's being granted to you. That's a difference between different countries. Yeah, we're all Hispanics, we speak Spanish, but there's a difference in attitude. And we do mention that a couple times, more than a few times throughout the course of the program.
Thank you, I appreciate that.
Louis,
can I do something?
go ahead, sorry.
Yeah, although Latina, I don't speak Spanish, I speak Portuguese, and I am a medical interpreter. And I just want to second what Louis said about being an advocate for the patient, because it's really very tough. Like when he said, sometimes the doctor doesn't understand why there's some confusion because of the culture of that particular country. So that can be a big barrier. So it's good when you just stop and explain to the doctor the way he's acting or talking is because of he's not understanding what the doctor says because of his culture background.
And thank you for mentioning that, because I just give a lot of examples from my background during the program, because there's this tiny but huge thing in interpreting, that's remaining neutral, or remaining legally neutral, as I call it. I tweaked it a little bit just to say that I need to remain legally neutral because your client is a medical facility, and they need to protect themselves, but hey, what about your patient? Okay, and there have been instances in which non-verbal cues, for example, have happened. A longer silence than you're normally used to, that means something. If your patient answers a question but they take a little longer, it may mean that they didn't understand, and it may mean many things. But I couldn't intervene because that may be taken as bias, for example. Okay, no, yeah, that's no interpreter, that's what you understand. Okay, but if only my provider had known such a thing, and it may be just a particular example, but it illustrates the point, right? If my provider had known this little thing about, cultural background of my patient, they might have picked up on that, and then might have decided to do some follow-up. Hey, did you really understand? Because some patients, they when you ask that question, they understand yes, or they answered yes. And many times it's just that they just want to be done with that situation. When you're not comfortable, you just want to leave. Okay. And if you are asked a question after, I don't know, being read a long disclosure when you don't understand legal language, you feel uncomfortable because you don't understand. There are too many words, too many long words, too many difficult words. Did you understand? Yeah, yeah, yeah. But that's just because they just want to leave. They want to be done with the situation. Did they answer truthfully? No, no, because they didn't know. But it's just that they are so stressed by what's happening, the circumstance, that they would lie, or they would say yes when they didn't really understand, because again, they want to be done. They want to leave. That particular answer may come again after a tiny longer pause than usual, but culture helps you pick up on that tiny longer pause that made all the difference.
Luis, I just have one final question as we, find ourselves in the middle of this global pandemic. Obviously, we're well aware of the importance of the importance that language and culture can play into that. So I'm just wondering if that has come up in the class, and if you've talked with the students or had a conversation about what sustainable health or sustainable healthcare looks like for the Latinx patient in this COVID era that we find ourselves in.
Yeah, of course. And one very important thing has been that one of the approaches to COVID has been contact tracing. And that has to do a lot with what Hispanics view as relationships. Okay, we were mentioning that we have what we call meaningful relationships. What does that mean? That means that as a patient, or actually as a person, in our culture, you open up to that person that you trust. Okay, you trust that person with whom you share common ground, and you trust a person that takes what you have to say, accepts it, or if not, understands it and shares it in any way possible. So other things about Hispanic culture that you may already know, or if you don't know, you need to understand is that privacy is big. Privacy, if you are a Hispanic undocumented immigrant, is huge because you're worried about your status being known. You only open up to those who you trust, and I think this is one point that we can use to build a bridge across cultures, because as a teenager you didn't tell your parents that you liked that particular person at school. You told your friend because your friend knew what was going on with you at school because you were both at school. Okay, if a third party whom I don't know asks me a question about that, which I think is very private, I'm going to say, who are you? Okay, and that's been happening with contact tracing. Okay, we reviewed an example from California in which third parties, complete strangers, would call you to ask, where have you been? Who have you been with? What are their names? What are their phone numbers? But the reaction is that either the contactee hangs up the phone, or they had a bad reaction. Who are you? Why are you asking those questions to me? Why? Because there are many circumstances, one of which is safety and security in their home countries. El Salvador, Guatemala, Peru, for example, or other countries in the region, okay? You don't just go out to the street, talk to people unless you know them, for example, because someone somewhere may have an ill intention. Okay, you are aware of that, you know that, you have it in your head. So when you move to the US, which by the way, one of the nicest things about the US is that you can just talk to people, right? There's a good spirit, inherent good spirit in people there. And when someone that you don't know calls you to perform contact tracing, you're going to have a bad reaction because Hispanics view that kind of information as intimate and private. So you need to be aware of that kind of reaction.
Okay, so if there's not any other questions, I just want to take the opportunity to say thank you, Luis, and to our students, Erica and Judy. Thank you for being here. I think this was an excellent presentation to tie into our theme of around the Sustainable Development Goals. So thank you, thank you. Yeah, we just really appreciate the partnership, and we're hopeful that we can continue to spread the importance about language and culture here at Marymount. So thanks again, Luis.
Again, thank you so very much for the opportunity. I mean, it's been great to have the chance to relay these concepts. I have no words, but thank you so much.
Thank you.
Thank you. Have a great afternoon, everyone.